Welcome to Coping with COVID-19, an editorially independent program from the editors of Modern Aesthetics Magazine and Practical Dermatology Magazine. In this episode, Drs. Joel Cohen, Doris Day, Steve Diane, Michael Gold, Mark Nestor, Joel Schlesinger, and Amy Taub talk about making plans to reopen medical and aesthetic dermatology practices.
I mean, if you think about the downward stream of this and the effect on the economy, people aren't going to be flying, okay? And I think that may be permanent to some degree. After 9/11, it took 2 years to come back. What's happening now, though, is we have technology that can usurp flying. In other words, look at us, okay? We're doing this Zoom meeting. I don't think any of us really would have thought about doing something like this a year ago, 2 years ago, whatever. The technology really wasn't there. The technology is there now that people don't have to travel for work anywhere near as much and could do Zoom, okay? The issue is we're going to be able to do Zoom conferences, okay? Big conferences by doing a lecture by Zoom or something like that.
I hope not. I hate this.
I know, but it's...
but the reality for the next 6 months, this is what we're going to be doing.
Next 6 months, I get it, but not the new reality, though.
No, I think Steve made the comment in one of our meetings that we want to see each other. I mean, you know,
I want to touch. I want to more than see. I want to be physical.
That's going to take time. You know, I mean, I think somebody said, "What's going to be the new greeting?" And sort of everybody went like this. You know, I mean.
You know, listen,
I like that.
I had Michael, when you had, at some of the international meetings, when you have it streaming and there's like not a million, but a much bigger audience, they could potentially pay less. You might still be able to keep, I mean, I'm talking about for people who like own their own meeting. Maybe it would extend the reach. It's still never going to be as good as if you're in person.
We agree 100%, and I think for the next 6 months we're not going to be able to do that. But I think in 2021, as things get a little better, hopefully for most everybody, the meeting world will be a combination of both. And right. So you'll go somewhere, but you'll stream it all over the place.
But think about the other side of it. If people are shut down, whether it's 100% or whether it's 50%. For the next 4 or 5 months, nobody's going to take the time, and I'm not talking about us that's going to talk, but nobody's going to take the time away from their practices to go travel to come to a meeting. That's
Steve will.
No, I'm saying that's us. We'll give
Doris
talk.
will.
Doris will. And I will.
We can have a meeting and talk to each other. Forget about the audience, right?
Well, so somebody asked me that question. I've been on the phone since 8 o'clock this morning. That's why I was late. I was at another Zoom meeting. I went over, but they were saying, could we ever plan a meeting virtually, okay, globally, and then say on, pick a day during the weekend during the year and say, everybody that is the faculty or whatever from that meeting, we're going to meet in Paris or wherever. No lectures, just a social meeting. Would you go?
Sure.
The question
this group would.
The question becomes, though, how do you sell things that make it worthwhile for support meetings?
Here's the issue, but the other side of it. So I had an interesting conversation with Benjamin, okay, talking about biggest meetings in the world, okay? What he said was very interesting, and they may have some really interesting surprises for MCAS. But if you think about it, both sides of the equation are much less. Yes, there'll be less revenue, but there'll be much, much less cost, okay? There won't be any hotel cost. There won't be any AV cost. There'll be, internet costs and things like that. So the bottom line is that you still can do this. You theoretically can have as wide or wider an audience, okay? But the cost structure is a lot less. Okay?
We all know that the best part of the meeting is the networking around the meeting and all the social events. So, right. I mean, when we go to meetings, how much do you really sit in on every lecture and how much is it that you're networking and running 5 million business meetings or enjoying the location. So we may have to raise the bar. I'm sure we have to raise the bar. I think the one good thing out of this is that meetings will have to work a lot harder to have their own unique angles that will make them more of a draw, because we now know that there will be more virtual meetings, so people will have more options. So either the presentations have to be at a different level, they have to be more interactive when they're live. You have to offer something live that you can't get virtually, is what it's going to come down to.
And it seems that
just before this conference call, I was on the phone for the the Mose College business meeting, and I must say that there were different speakers every couple minutes who gave updates on their different committees, and it completely dovetailed very nicely, and it ran very, very smoothly. So I think that there are certain types of meetings that may actually lend themselves to doing something.
But you got to have support.
And then in terms of like content, when we're giving scientific data or we're giving updates, my concern is it's going to be a different type of issue, because similar to these athletes who are now probably going to be asked to perform without fans, we don't have the opportunity in those circumstances when we're sitting at our computer like this to really read the crowd. We don't know the momentum and the cadence.
Yeah, very true.
And the type of questions and the level of sophistication of the audience. And that's going to be really, really difficult to figure out how to integrate into this.
Right.
That's a great point.
And when you're doing virtual type things, that's what I'm doing every other second. MedDerm is okay. MedDerm companies, easy. They want to get in front of people like they do with so they're not the ones that are, and they have the pocketbooks to help for the most part. Cosmetic laser companies, skincare companies, the bread and butter of what we do, virtual doesn't work for them. And so you've got to come up with unique and different ways. And when you get the formula, let us all know.
Wait a second. I disagree with that. I just think that the model hasn't been built yet. So you could say, like, let's say you're going to do something on a specific product, Rustylane, I don't care what it is. And then you do a demo just like you would in person. And that's great.
But it's not toxin and filler companies. I'm talking about laser and skincare companies. Toxin and filler companies are fine. They have plenty of money.
Well, just let me finish. And then instead of like you go to the booth, you can sign up to have a one-on-one meeting with the MSL or the whoever through this kind of an interface where you're basically, especially a one-on-one meeting. I know Doris likes to touch, but I feel like sometimes when I'm on my telemedicine with my patients, it's like their face is so like right in there, in some ways it feels more intimate. I don't know how to describe that, but it's like you're in their house.
So that model's been set up, and a lot of companies, you're going to see that in the next 6 months.
Yeah, I think you will see it.
But I'm not sure the laser and skincare companies want to spend that kind of money.
Well, it's more intimate in that in a telemedicine, it's more intimate because it's you and the patient, right? And your attention has to be constant. Whereas in a room, or if there's other people around, or if you're in a meeting with many people,
right,
somebody can be, it's not as intimate, right? So right, if it's two people, yes, because it's 100% of the attention and focus. But what we're talking about is a larger group, and I think you lose a lot of intimacy. And the touch isn't just physical; it's knowing that the other person is there.
Right.
Absolutely,
it's very powerful.
Yep, I agree.
Down here, Michael, is the difference between skincare companies and device companies. I've actually had a lot of positive feedback from skincare companies just because we can sell skincare products virtually, or as Joel does online, and others, and Amy does, and a lot of us do online. So they actually look at this as a big opportunity because people aren't getting toxin, people aren't getting laser treatments, but they can buy skincare products.
And furthermore, they're not going. Furthermore, Sephora's closed, and
right,
they can't go around and browse stuff either. Right, so they're more of a captive audience.
Right. We'll see.
Honestly, when you mentioned Sephora right now, but I think that you might be able to look at this in some ways and think about the fact that every day when people turn on TV, they see the credentials of a doctor. They know that Dr. Fauci is the expert, that Dr. Birx is the expert, that Dr. Redfield runs the CDC, and they talk about these people's accolades, and there is a return to credentialing people. So if you think about that, there perhaps in our offices could be a return to credentialing where some of these types of things matter, where accomplishment and publications and track record of successful procedures, and not just Instagram followers of a spa or something like that, may actually matter. And then secondly, in terms of Sephora, when these places do open up, would you, as a consumer, rather go to a mall with a lot of other people there, or would you rather come to a smaller medical office where you might be the only person in that practice's store and get personalized attention and not have anybody else kind of coughing or potentially breathing on you? I think that
and also touching samples that everyone else has touched. I mean, we're going to make it so that the samples we have is only going to be touched by the staff. If you want some, we'll pump it onto your hand for you. And we're also cleaning it in between, if we're even going to have sample, right, testing products. But if you go to places like Sephora, as you were saying it, I didn't even think about it, but if you go into Sephora, everything is there for people to touch. And who's going to want to touch anything anymore or try anything in that kind of environment, or a department store?
Doris, you are touching on something now that I think this mind trust here has to become very creative about. And that is absolutely, how do we think about the future? How do we think about how we engineer our practices and engineer our ways of doing things to fit the mindset of paranoia, which should be there? And things are going to have to change dramatically. Things are changing now dramatically across the board. What we have to do, and you've touched on it, and people have taken, simple things like they've taken all the magazines out of the waiting rooms. Are we going to have little brochures in our rooms for people to take about procedures? No, because you don't know who touched them. So all of these aspects that are very practical aspects have to change. The way we're doing things have to change.